Throughout human history, deadly diseases have shaped societies, economies, and even the course of civilizations. From ancient times to the modern era, pandemics and epidemics have swept across continents, leaving profound impacts on populations. Ebola, also known as Ebola virus disease, is a viral hemorrhagic fever in humans and other primates, caused by Ebola viruses. Symptoms typically start anywhere between 2 days and 3 weeks after infection. The first symptoms are usually fever, sore throat, muscle pain, and headaches. These are usually followed by vomiting, diarrhea, rash, and decreased liver and kidney function, at which point some people begin to bleed both internally and externally. It kills between 25% and 90% of those infected, about 50% on average. Death is often due to shock from fluid loss, and typically occurs between 6 and 16 days after the first symptoms appear. Early treatment of symptoms increases the survival rate considerably compared to late start. An Ebola vaccine was approved by the US FDA in December 2019. The virus spreads through direct contact with body fluids, such as blood from infected humans or other animals, or from contact with items that have recently been contaminated with infected body fluids. Control of outbreaks requires coordinated medical services and community engagement, including rapid detection, contact tracing of those exposed, quick access to laboratory services, care for those infected, and proper disposal of the dead through cremation or burial. Bubonic plague. The Black Death was a bubonic plague pandemic occurring in Europe from 1346 to 1353. One of the most fatal pandemics in human history. As many as 50 million people perished, perhaps 50% of Europe's 14th century population. Bubonic plague is caused by the bacterium Yersinia pestis and spread by fleas. One of the most significant events in European history, the Black Death had far-reaching population, economic, and cultural impacts. It was the beginning of the Second Plague pandemic. The plague created religious, social, and economic upheavals, with profound effects on the course of European history. The origin of the Black Death is disputed. Genetic analysis points to the evolution of Yersinia pestis in the Tian Shan Mountains on the border between Kyrgyzstan and China 2,600 years ago. The immediate territorial origins of the Black Death and its outbreak remain unclear, with some evidence pointing towards Central Asia, China, the Middle East, and Europe. The pandemic was reportedly first introduced to Europe during the siege of the Genoese trading port of Kaffa in Crimea by the Golden Horde army of Yani Beg in 1347. Spanish flu. The 1918 to 1920 flu pandemic, also known as the Great Influenza Epidemic or by the common misnomer Spanish flu, was an exceptionally deadly global influenza pandemic caused by the H1N1 influenza A virus. The earliest documented case was March 1918 in the state of Kansas in the United States, with further cases recorded in France, Germany, and the United Kingdom in April. 2 years later, nearly a third of the global population, or an estimated 500 million people, had been infected in 4 successive waves. Estimates of deaths range from 17 million to 50 million, and possibly as high as 100 million, making it one of the deadliest pandemics in history. The pandemic broke out near the end of World War I, when wartime censors in the belligerent countries suppressed bad news to maintain morale, but newspapers freely reported the outbreak in neutral Spain, creating a false impression of Spain as the epicenter and leading to the Spanish flu misnomer. Limited historical epidemiological data make the pandemic's geographic origin indeterminate, with competing hypotheses on the initial spread. Spanish flu outbreaks disproportionately kill the young and old, with a higher survival rate in between. But this pandemic had unusually high mortality for young adults. Scientists offer several explanations for the high mortality, including a 6-year climate anomaly affecting migration of disease vectors with increased likelihood of spread through bodies of water. Tuberculosis, or TB, also known colloquially as the White Death, or historically as consumption, is an infectious disease usually caused by Mycobacterium tuberculosis, MTB, bacteria. Tuberculosis generally affects the lungs, but it can also affect other parts of the body. Most infections show no symptoms, in which case it is known as latent tuberculosis. Around 10% of latent infections progress to active disease which, if left untreated, kill about half of those affected. Typical symptoms of active TB are chronic cough with blood-containing mucus, fever, night sweats, and weight loss. Infection of other organs can cause a wide range of symptoms. Tuberculosis is spread from one person to the next through the air when people who have active TB in their lungs cough, spit, speak, or sneeze. People with latent TB do not spread the disease. Active infection occurs more often in people with HIV/AIDS and in those who smoke. Prevention of TB involves screening those at high risk, early detection and treatment of cases, and vaccination with the Bacillus calmette-guerin vaccine. In 2018, 1/4 of the world's population was thought to have a latent infection of TB. Polio. Approximately 75% of cases are asymptomatic. Mild symptoms which can occur include sore throat and fever. In a proportion of cases, more severe symptoms develop such as headache, neck stiffness, and paresthesia. These symptoms usually pass within 1 or 2 weeks. A less common symptom is permanent paralysis and possible death in extreme cases. Years after recovery, post-polio syndrome may occur, with a slow development of muscle weakness similar to that which the person had during the initial infection. Polio occurs naturally only in humans. It is highly infectious and is spread from person to person either through fecal-oral transmission like poor hygiene, or by ingestion of food or water contaminated by human feces, or via the oral route. Those who are infected may spread the disease for up to 6 weeks even if no symptoms are present. The disease may be diagnosed by finding the virus in the feces or detecting antibodies against it in the blood. Poliomyelitis has existed for thousands of years, with depictions of the disease in ancient art. Once infected, there is no specific treatment. The disease can be prevented by the polio vaccine, with multiple doses required for lifelong protection. Malaria. Malaria is a mosquito-borne infectious disease that affects vertebrates. Human malaria causes symptoms that typically include fever, fatigue, vomiting, and headaches. In severe cases, it can cause jaundice, seizures, coma, or death. Symptoms usually begin 10 to 15 days after being bitten by an infected Anopheles mosquito. If not properly treated, people may have recurrences of the disease months later. In those who have recently survived an infection, reinfection usually causes milder symptoms. This partial resistance disappears over months to years if the person has no continuing exposure to malaria. Human malaria is caused by single-celled microorganisms of the Plasmodium group. It is spread exclusively through bites of infected female Anopheles mosquitoes. The risk of disease can be reduced by preventing mosquito bites through the use of mosquito nets and insect repellents, or with mosquito control measures such as spraying insecticides and draining standing water. Several medications are available to prevent malaria for travelers in areas where the disease is common. The disease is widespread in the tropical and subtropical regions that exist in a broad band around the equator. This includes much of sub-Saharan Africa, Asia, and Latin America. In 2022, some 249 million cases of malaria worldwide resulted in an estimated 608,000 deaths, with 80% being 5 years old or less. Smallpox. Smallpox was an infectious disease caused by variola virus, which belongs to the genus Orthopoxvirus. The last naturally occurring case was diagnosed in October 1977, and the World Health Organization certified the global eradication of the disease in 1980. Making smallpox the only human disease to have been eradicated to date. The initial symptoms of the disease included fever and vomiting. This was followed by formation of ulcers in the mouth and a skin rash. Over a number of days, the skin rash turned into the characteristic fluid-filled blisters with a dent in the center. The bumps then scabbed over and fell off, leaving scars. The disease was transmitted from one person to another primarily through prolonged face-to-face contact with an infected person or, rarely, via contaminated objects. Prevention was achieved mainly through the smallpox vaccine. Once the disease had developed, certain antiviral medications could potentially have helped, but such medications did not become available until after the disease was eradicated. The risk of death was about 30%, with higher rates among babies. Often, those who survived had extensive scarring of their skin, and some were left blind. Cholera. Cholera is an infection of the small intestine by some strains of the bacterium Vibrio cholerae. Symptoms may range from none, to mild, to severe. The classic symptom is large amounts of watery diarrhea lasting a few days. Vomiting and muscle cramps may also occur. Diarrhea can be so severe that it leads within hours to severe dehydration and electrolyte imbalance. This may result in sunken eyes, cold skin, decreased skin elasticity, and wrinkling of the hands and feet. Dehydration can cause the skin to turn bluish. Symptoms start 2 hours to 5 days after exposure. It is spread mostly by unsafe water and unsafe food that has been contaminated with human feces containing the bacteria. Undercooked shellfish is a common source. Humans are the only known host for the bacteria. Risk factors for the disease include poor sanitation, insufficient clean drinking water, and poverty. Cholera can be diagnosed by a stool test or a rapid dipstick test, although the dipstick test is less accurate. Cholera continues to affect an estimated 3 to 5 million people worldwide and causes 28,800 to 130,000 deaths a year. Leprosy, also known as Hansen's disease, is a long-term infection by the bacteria Mycobacterium leprae or Mycobacterium lepromatosis. Infection can lead to damage of the nerves, respiratory tract, skin, and eyes. This nerve damage may result in a lack of ability to feel pain, which can lead to the loss of parts of a person's extremities from repeated injuries or infection through unnoticed wounds. An infected person may also experience muscle weakness and poor eyesight. Leprosy symptoms may begin within 1 year, but, for some people, symptoms may take 20 years or more to occur. Leprosy is spread between people, although extensive contact is necessary. Leprosy has a low pathogenicity, and 95% of people who contract M. leprae do not develop the disease. Spread is thought to occur through a cough or contact with fluid from the nose of a person infected by leprosy. Genetic factors and immune function play a role in how easily a person catches the disease. Leprosy does not spread during pregnancy to the unborn child or through sexual contact. Leprosy occurs more commonly among people living in poverty. There are 2 main types of the disease, paucibacillary and multibacillary, which differ in the number of bacteria present. A person with paucibacillary disease has 5 or fewer poorly pigmented, numb skin patches, while a person with multibacillary disease has more than 5 skin patches. The diagnosis is confirmed by finding acid-fast bacilli in a biopsy of the skin. Leprosy is curable with multi-drug therapy. Treatment of paucibacillary leprosy is with the medications dapsone, rifampicin, and clofazimine for 6 months. Leprosy is not highly contagious. People with leprosy can live with their families and go to school and work. Typhus, also known as typhus fever, is a group of infectious diseases that include epidemic typhus, scrub typhus, and murine typhus. Common symptoms include fever, headache, and a rash. Typically, these begin 1 to 2 weeks after exposure. The diseases are caused by specific types of bacterial infection. Epidemic typhus is caused by Rickettsia prowazekii spread by body lice. Scrub typhus is caused by Orientia tsutsugamushi spread by chiggers, and murine typhus is caused by Rickettsia typhi spread by fleas. Vaccines have been developed, but none are commercially available. Prevention is achieved by reducing exposure to the organisms that spread the disease. Treatment is with the antibiotic doxycycline. Epidemic typhus generally occurs in outbreaks when poor sanitary conditions and crowding are present. While once common, it is now rare. Scrub typhus occurs in Southeast Asia, Japan, and Northern Australia. Murine typhus occurs in tropical and subtropical areas of the world. HIV/AIDS. The human immunodeficiency virus, HIV, is a retrovirus that attacks the immune system. It can be managed with treatment. Without treatment, it can lead to a spectrum of conditions including acquired immunodeficiency syndrome, AIDS. Effective treatment for HIV-positive people living with HIV, involves a lifelong regimen of medicine to suppress the virus, making the viral load undetectable. There is no vaccine or cure for HIV. An HIV-positive person on treatment can expect to live a normal life and die with the virus, not of it. Treatment is recommended as soon as the diagnosis is made. Without treatment, the infection can interfere with the immune system and eventually progress to AIDS, sometimes taking many years. Following initial infection, an individual may not notice any symptoms or may experience a brief period of influenza-like illness. During this period, the person may not know that they are HIV positive, yet they will be able to pass on the virus. Typically, This period is followed by a prolonged incubation period with no symptoms. Eventually, the HIV infection increases the risk of developing other infections such as tuberculosis, as well as other opportunistic infections and tumors which are rare in people who have normal immune function. HIV is spread primarily by unprotected sex, including anal and vaginal sex, contaminated hypodermic needles or blood transfusions, and from mother to child during pregnancy, delivery, or breastfeeding. Some bodily fluids, such as saliva, sweat, and tears, do not transmit the virus. Oral sex has little risk of transmitting the virus.